This webinar is going to cover the major components of the female reproductive system. Now, the female reproductive physiology is much more difficult, and that's what we'll be covering in lecture. I'm going to only cover some of the major components of the female reproductive tract and their functions. So we're going to start with an overview. So the primary female sex organs, or the gonads, are the ovaries. So you have two of them. They're homologous to the male's testes. The male testes is involved in gamete production as well as hormone production, while in the female, same thing. In this case, the female gametes, we're just doing very generic for now. We'll talk about more in lecture, or we're going to say is the eggs. They'll develop within the ovaries. The ovaries is also where we have production of the female sex hormones. We have estrogens as well as progestins. And we'll talk about those hormones and what they do. Around day 14 of a female's reproductive cycle, an egg will be released into the fallopian tube. The fallopian tube is also referred to as the uterine tube. So it's released into the uterine tube. You can call it the fallopian tube. There's other things that you can refer to it as. It then travels down the tube into the uterus. We'll look at this structure a little bit more in depth. And if there was no fertilization of the egg at some part of the month, the lining of the uterus will be shut off during menses. If the egg was fertilized and it developed in the uterus, a lot longer, it's going to be a lot longer before the baby comes out, but they'll exit through the cervix, which is really the neck of the uterus, and then out through the vagina. Okay, but we're going to go look at these a little bit more in depth shortly. So we'll start with the ovary. Now, the ovaries are located on the posterior side of the pelvic cavity. Now, they're held in place by various ligaments. So the first one is the broad ligament. And the broad ligament, you see here, is going to be involved in not only supporting the ovary, but also supports the fallopian tubes and the uterus. The ovarian ligaments, you see one here, there's one here, there's one here. The ovarian ligaments will be, you see, comes from the uterus to the medial side of each ovary. And the last one is the suspensory ligament. Now that one goes from the lateral surface of the ovary to what we refer to as the infundibulum, which is a portion of the fallopian tube. The fallopian tube we'll talk about very shortly, but the ovary is where, we had mentioned, where the eggs or the ova will develop, and you have the productions of sex hormones. Now, one of the ones that we're just going to say, just very generally, estrogens will be the ones responsible for having the egg develop properly within the ovary, and also helps to proliferate the uterine lining. This one I'm going to actually give the specific name of a hormone. Progesterone is required for the preparation of the lining for possible implantation. We'll talk about more in depth during lecture, because these are not the only things that these hormones do. Now, if we look at the fallopian tubes, go back here to this one. If we section through the fallopian tubes, we're going to see a certain type of epithelium. We're going to see different types of cells. So let's just look at the fallopian tubes. Fallopian tubes can be called uterine tubes, oviducts, salpinges. That's all the terms that use for fallopian tubes. The closest end of the fallopian tube forms kind of this funnel-like infundibulum. That funnel type thing is referred to an infundibulum. This is one thing you need to be very wary about. You can never just say infundibulum, or you can never just say what you'll see here, ampulla. Because these are general terms that can be referred to other parts in our body. So you must say infundibulum of the fallopian tube, or ampulla of the fallopian tube, because infundibulum is a generic term for something that's a kind of expanded funnel type structure. So that has branches called fimbriae. Okay, so you have these little things called fimbriae. that kind of extend towards the ovary. Now, if I come back here, I just wanted to show you, there is no direct connection between the ovary and the fallopian tubes. And so when the egg is ovulated, it's ovulated into the peritoneal cavity. And there's a chance that it's going to never make its way in the fallopian tube. Well, what happens is the fimbriae, they become engorged with blood at a certain time of the month, and they start to move and help propel and draw. Then here's the fimbriae here, draw the egg into the fallopian tube. And what actually helps in this happening is high estrogen levels at the time of the month that a woman is ovulating. Now, if we go back here, up here, this part right here kind of bends. It's called the ampulla. The ampulla is the site where most fertilization takes place. This is that part of the fallopian tube. So fertilization takes place, for the most part, for most people, within the fallopian tube, but it's within the ampulla of the fallopian tube. The fallopian tube is lined with smooth muscle, and it's responsible, again, like what you've seen with the male, for peristalsis. So it's going to propel the egg down the fallopian tube. And also lining the fallopian tube, we have columnar epithelium. We have two different types of cells. We have ciliated cells, and you learned about cilia in AMP1. They actually are modal. The cilia is modal. That's going to help to aid movement towards the uterus, the egg towards the uterus. The estrogens actually increase production of the cilia on these cells. So at the time of the month when a woman's going to be ovulating, estrogen levels are very high. It promotes the cilia production that helps with the movement of the egg. They also have these secretory cells that's referred to as PEG cells. PEG cells are not ciliated, but they produce fluid that contains different nutrients for sperm, because they're traveling up, they need food too. I mean, they got their fructose, but they still want some food. It helps give food for the oocytes, and also if there was fertilization, the zygotes. So a zygote is where you have the fertilized egg. It starts to develop, and it takes about a week before that fertilized egg makes its way to the uterus, so it needs some food. So it helps with food there. Now, the secretions from the fallopian tube also promote capacitation, like I mentioned with the male reproductive system. Capacitation should not take place until the sperm hit the female reproductive tract. Now, I do want to talk about some terms, just so you're aware of it. And this is a picture. I mean, that may gross you out, but if you're going to be in healthcare, you have to be able to deal with looking at some gross things. Is a salpingectomy. So if you remember, I said this fallopian tubes could also be called salpinges. A salpingectomy is where you remove a fallopian tube. If you have a fallopian tube removed with at least one of your ovaries, it's called a salpingo-oophorectomy. So the oophorectomy has to do with the ovary. So in this picture you'll see this is a tumor right here. This structure here is the uterus. It's hard to see, but there's the fallopian tube, and you can't really see the ovary. But the tumor was very vascular, and it kind of enveloped around the fallopian tube and the ovary. So when the surgery was done, they had to do a salpingo-oophorectomy. So this surgery involved that. Same surgery, though, because it's going to lead us into our next structure, is the uterus was obviously removed, and the tumor was actually a cervical tumor. And the cervix is really the neck of the uterus. And so this was an example of what we call a complete hysterectomy. In a complete hysterectomy, the uterus and the cervix are removed. In a subtotal hysterectomy, only the uterus is removed. They keep the cervix intact. Now, the cervix had to be removed because, obviously, they said they couldn't find it. Now, this picture is actually surgery from me. So I had this done a number of years ago. Eventually, in a few years after that, I lost the other fallopian tube as well as the ovary. Let's talk about the uterus. So we'll say the egg has made its way down the fallopian tubes and gone into the uterus. So here you see a sagittal section of the uterus. To show you where it's located, it's in the pelvis between the rectum, which you see here, and the bladder. So you can kind of see where if a woman's pregnant, it presses on the bladder. That's why she has to pee all the time. Now it's going to be supported again by various ligaments. Now if you look at, we're going to look at another picture so you can see some of the structure. So we're going to look at an anterior view. Is the top part of the uterus is referred to as the fundus. Again, you must say fundus of the uterus because when we do GI tract, we'll talk about the fundic area of the stomach. So fundus, again, just a general term. So the fundus of the uterus is the top where you see the fallopian tubes enter. This thick part here is the body. Here's the body. Got the body. And the last part is referred to as the isthmus. In the isthmus, the muscle that we'll talk about is a little bit more narrowed and a little bit thinner in the isthmus of the uterus. Now the lower part or the neck of the uterus is referred to as a cervix. So the cervix is the neck of the uterus. Now the cervix, we have what we call an internal os or internal orifice, and we have an external os. So the opening into the uterus is the internal os, and the opening to the vagina is referred to as the external os. So you see it's you'll see it start to narrow. So you got the internal and you have the external. Now the cervix has a lot of glands associated with it, and the mucus that it secretes it's a viscous fluid, but its consistency changes throughout the female reproductive cycle in response to various changes in the hormone levels. When a woman ovulates, the fluid is very thin and serous. So you want the sperm to be able to come up the vagina, travel up here, and then make its way up that way. So you want it thin so it doesn't impede forward flow of the sperm. But it's also more alkaline. So because remember I said the female reproductive tract normally is kind of a little bit acidic, you want it to be a little bit more alkaline to kind of help with the sperm. The high estrogen levels will be more responsible for the mucus being a little bit thinner at that time of the month during ovulation. At other times of the cycle, it's more viscous, so it acts as a barrier for anything entering in. And especially during pregnancy, there actually is a plug that's formed during pregnancy, and it acts as a protective seal. It prevents bacteria, it has antibacterial actions, prevents things from entering the uterus and also any leaked out fluids. That plug will be expelled during shortly before childbirth. You'll also notice that the wall has 3 layers. Now the top, let's see which one's the better picture, so we'll go here. You can see it, we'll at least see it in different view. The top, the visceral layer is, the covering is the perimetrium. The bulk of the uterus is the myometrium. Remember, myo means muscle, it's smooth muscle. When it contracts, will be involved in the uncomfortable getting cramps when you're having your period, but also it's going to be important in childbirth. The inner lining is the endometrium. Okay, so it's the inner. This is where the blastocyst, which what a term that we refer to as the egg has developed into a certain structure after it's been fertilized. This is where it's going to implant and eventually develop into an embryo to a fetus and eventually a baby. The endometrial lining undergoes a lot of cyclical changes during a reproductive cycle. We will cover this during lecture, but I wanted to show you the changes within the uterine lining. So when a woman's having her period, or menses, she's losing multiple layers of the endometrial wall. So they're just it's being sloughed off. And see, here's the muscle, but all this other stuff was coming off. Later on, it will proliferate in response to estrogens and then becomes more secretory in response to progesterone to make it more hospitable for implantation. So it undergoes a lot of cyclical changes. Now, there are some women that have endometrial tissue in places where it's not supposed to be, and they have what we refer to as endometriosis. And notice it can be in a lot of very interesting places, in the intestine, in the colon, in the bladder, places where it's not supposed to. Well, the endometrial tissue will undergo the changes that your normal endometrial tissue would during the female reproductive cycle. But the thing is, it doesn't get shed off during menses, and it can result in scarring, adhesions, and it could also lead to a woman being infertile. Does not necessarily you'll be infertile, but it's a very uncomfortable condition that a lot of women have, is endometriosis. Now, the vagina is the area where during the menstrual period the secretions, the endometrial tissue, some blood will be going down through the vagina, but this also is the area where a child would be born. It's also the area where the penis is inserted during intercourse. The vagina is has the kind of folds called rugae. Now, if we kind of look through a section of the vagina, the epithelium is stratified squamous. Now, this is non-cornified. It's you've heard it as non-keratinized. So it is not dry like the skin. Our skin is keratinized. This is moist. It's non-keratinized. So it's multiple layers, serves as a protective role. So it has the stratified squamous, non-keratinized epithelium. It has smooth muscle, so it's going to contract, and it's got a fibrous coat to it. Now, a healthy vagina is acidic. So it is a normal female healthy vagina is slightly acidic. So again, that being acidic is not generally very hospitable for sperm. So under certain conditions, we need to change the environment early up, like we talk about with the cervix, but it tends to be slightly acidic. Now, if we also then kind of go through to the external genitalia of the female, and the external genitalia is referred to, if they use the term vulva, that's the term for the external genitalia in the female. So we're going to look at some of the structures. First one, you have the labia majora. So the labia majora, you see here on either side, it's folds of tissue that has fat associated with it. It's got some muscles covered with, on the outer surface, with skin and hair. General rule or function is to protect the urethra, the vagina, because it kind of encloses a region referred to as the vestibule. And the vestibule is this whole area here. It has the opening it's got the vagina here, and this is the urethra opening in the female. Now, the top part here merges on the labia majora merge on the anterior portion is the mons pubis, kind of a little fatty elevation covered in hair is the mons pubis. At the bottom, it merges to form, where we here, from here to here, is the perineum. The perineum is the area that during childbirth can be ripped or surgically cut to make it easier for a child to be born, and they refer to it as an episiotomy if they had cut the perineal region. Now, the labia majora is homologous to the male scrotum. So there are a lot of structures, males, females, they're kind of similar. So it kind of has a similar function is to kind of protect. Also, there are some vestibular glands where they refer to as Bartholin glands, and they're equivalent to the bulbourethral glands in the males, and it acts as a lubricant. Now, let me erase this. The labia minora, you see here, can't do it. You see here the inner part, there kind of folds on the inner part of the the labia majora. They're homologous to the male foreskin. So male foreskin is what's circumcised if a male does get circumcised. And it helps to again protect, its purpose is to protect the vagina, but it also contains a lot of sensory endings as well as some secretions for lubrication. The clitoris is, and you're just seeing part of the clitoris, but here's the glands, the prepuce, you don't have to say that, but the clitoris is the male equivalent of the penis. So it has erectile tissue. So it's completely analogous to male. So it has, in this case, it has the corpora cavernosa. It does not have a corpus spongiosum. So it is erectile, and it does also contain sensory nerves. Here is a sagittal view, so you can see the structures. So you'll notice here it says labium majus, labium minus. Those are the singular terms. The labia majora is plural. The labia minora is plural. So this is just B1 because you're only seeing one of them. This greater vestibular gland, that is those Bartholin's glands that secrete lubricant. You'll notice this, on this it says periurethral glands. That's going to be involved in lubrication for the urethra. And also you'll notice again the proximity of the, since I talked about it with the male, is here's the urethra. See how close it is to the anus versus the male? Male's was much further away. Plus you notice the urethra is much shorter. And so I just want to remind you about that. All right, so that's last thing I want to talk about is the mammary gland. The mammary glands are important for if a woman decides to breastfeed. It is a fat pad. It's composed of a lot of fat, adipose tissue. It's a modified sweat gland. And it has, in a lactating female, a lot of lobes, a lot of glandular material. And on the outer part here, the pigmented part, which you see here is called the areola. In a lactating female, the alveolar glands will pass milk through what we call lactiferous ducts, and they enlarge or dilate to form a sinus, lactiferous sinus. You can say, here's some duct, you get the ducts and sinuses, and they open into the nipple. Now, the development of these alveoli, a lot of the alveoli is that term for kind of these glands that you get in the breast. That is promoted by progesterone. So progesterone, I had mentioned, is going to be involved in what's going on in the uterus after to promote implantation, but it will help prepare a woman for after she gives birth to breastfeed. So I want you to think progesterone is a progestin. Literally means for gestation. It's preparing you for having a kid. So progesterone helps the development of the breast to become very glandular. The production of the milk is controlled by prolactin. We talk about prolactin in the endocrine system. Now, a female who is not lactating, you won't see all this glands. It's going to be mainly adipose tissue with some collagen and some different connective tissue. So here is a section of a mammary gland of a woman that's not lactating. You don't see a heck of a lot of the glandular material, a lot of connective tissue. Here's from a woman that was breastfeeding. So got all these glands, and here's an electriferous duct, so you can see it right there. So it's a lot different. So if you have it happen from a section from a woman that's not pregnant versus a woman who is breastfeeding, it's going to look much different.